Good morning, everybody. As at 8 p.m. yesterday, we had 2 additional cases of community transmission. One case we had already spoken about yesterday. The additional case is a household contact of a case we spoke about yesterday. So that's one case which the community wasn't aware of. Since 8 p.m. yesterday, however, we have had 2 additional cases. They are both close contacts of existing cases. However, one was somebody from the Salvation Army, and Dr. Kerry Chant will be providing details about that. And the other person was again a close contact of someone who had the virus. Now, given the number of additional cases, the New South Wales government, based on the health advice, is extending some of the restrictions we spoke about last week. Now, it's really important for all of us to be on high alert no matter where we live. But in particular, as you know, in Greater Sydney, we've asked everybody to wear a mask on public transport until Wednesday midnight or Thursday morning. We are now going to do that as well in Wollongong and Shell Harbour local government areas. We have had a few cases there, even though they're directly linked to the eastern suburbs cases. We're concerned there may have been some circulation in the community. So the mandatory mask wearing on public transport will also be extended to the Wollongong and Shell Harbour local government areas. Now, in addition to public transport, there will be 7 councils or local government areas within Sydney covering the CBD itself of Sydney, the east and the inner west, and the southeast, east and inner west, and Dr. Chant will outline those 7 council areas. Well, we are going to ask people to wear a mask indoors in a mandatory way. So you must wear a mask if you are in and around those 7 local government areas, and that will include things like hospitality workers, it will include shopping, retail shopping, any indoor activity where you're not eating or drinking. You will need to wear a mask, and Dr. Chant will outline those 7 local government areas, but they include areas obviously in the Sydney CBD, the inner east, the inner west and the southeast of Sydney, and those 7 local government areas will have mandatory mask wearing within those areas indoors, as well as of course the mandatory public transport mask wearing which exists in Greater Sydney. Now, at this stage, we did not want to make the decision to have compulsory indoor mask wearing across all of Greater Sydney, but if the situation changes overnight, that is an option that we will have to consider. But at this stage, we don't think we need to do any further than what we've announced today, but it does mean people have to be really active in getting the information to make sure that they're compliant, and compliance is so important. I know that all of us are a bit fatigued after so many months of living with COVID, but we can't drop the ball now. We have to make sure we're not complacent. We have to make sure that we are complying to what we're asking you to do. Please, we don't want to have to extend further restrictions unless we absolutely have to, but that does mean that everybody who is in and around those 7 local government areas within Sydney will have to wear a mask indoors if you're a hospitality worker, if you're going shopping, if you're undertaking other activity indoors, unless you're eating or drinking, obviously. And that will apply effective immediately, but obviously compliance from 4 p.m. But we do want people to start doing that from now, and that will be for the same period as compulsory public transport mask wearing. So until Wednesday midnight, Thursday morning, that's what we'll be asking people to do. Now, overnight, we did have 24,500 people that came forward and got tested, which isn't bad, and we're pleased with that, but we do want more testing. The higher the rate of testing, the more confidence we'll have that we've captured all the cases that are currently circulating in the community. Now, as Dr. Chant will explain in her update, one of the cases of transmission was for a prolonged period, so the people were together for quite a considerable time, and so that explains how the virus was transmitted. But as we heard in the previous few days, on a couple of occasions it's been a very fleeting exchange. So we know this strain of the virus, which is becoming the dominant strain, is extremely contagious, and some people are spreading it more than others, and what we want to avoid at this stage is a super spreading event. Fortunately, with this current outbreak, we've not experienced a super spreading event where numerous people have been infected at the one time, and that's what we want to prevent, which is why in those categories we've asked people to wear a mask. So just to recap, The compulsory public transport mask wearing also extends to Wollongong and Shellharbour local government areas. And also in Sydney, there'll be 7 local government areas in the CBD, the inner west, the inner east and the inner south, where people will be required to wear a mask if they're a hospitality worker, if they're shopping, if they're engaging in any indoor activity, unless they're eating or drinking. I'll now ask Dr. Chant to give an update, and of course then we'll take questions. But my strongest message to the community is the next few days are critical. Now, we've held off on being more heavy-handed than what we are in relation to what we're asking people to do, but that will depend on what the cases, if any, emerge in the next few days. We just ask everybody not to be complacent. We know everybody's tired, we know everybody is fatigued, all of us are, but we have to keep doing the right thing until we get the vaccine to the majority of our population. This is the way in which we need to live, and that's why I'm so have a sense of urgency about getting the vaccine rollout, because once the majority of our population is vaccinated, obviously life will be different. But until that time, we have to follow the instructions of the health advice to make sure we keep everybody safe. And as you know, the New South Wales government, based on the health advice, doesn't like to impose anything unless we absolutely have to. At this stage, what we've asked people to do today is as far as we'll go. But I will say that if cases continue to emerge in the community, we will need to consider going further. But I hope that's not the case. I hope in the next few days things settle down and we don't have to go any further. I'll now ask Dr. Chant to give her update and then we'll take questions. Thank you.
Thank you, Premier. And I might start off by listing those local council areas. So they're Randwick Local Government Area, Bayside Local Government Area, Botany Bay Local Government Area, Inner West Local Government Area, City of Sydney Local Government Area, Waverley Local Government Area and Wallara Local Government Area. So if I now go back to the update, we have, as the Premier had indicated, we had 2 new locally acquired cases to 8 p.m. last night. One of those was announced yesterday, Saturday morning, to the media. It was a man in his 30s who lives in the Sydney CBD, but he had attended Westfield Bondi Junction and has spent time in the Wollongong area. He's included in today's numbers, and also another locally acquired case was a woman in her 30s, is a household man of this gentleman, and she had also attended Westfield Bondi Junction, but obviously she was a close contact of that gentleman in his 30s, a household contact. In addition to after 8 p.m, we've had one woman in her 50s from the Sutherland Shire, and she's a close contact of the previously reported case, a family contact of that case. She has been in isolation, and the case was reported last night and will be included in Monday's numbers. The key is she was in isolation, but there may be some additional venues. Obviously, this is again why we need people to get tested soon, very quickly, and obviously so we can get ahead of how the virus is spreading. So there may be some exposure venues that we identified from her. Investigations are ongoing, and just this morning we've been notified of an additional case, a man also from the Sutherland area in his 50s. He's a close contact of a previously reported case and has been in isolation, and again, they're not necessarily for the full period. Those investigations will be underway, so it will be important to alert you, and that was in relation to a gentleman who we think the exposure source was in the course of his employment at Salvation Army shop, but we will clarify that as we've undertaken the interview and confirm whether he was exposed. So in essence, we're also wanting to redouble our efforts to get testing of anyone who was in Westfield's Bondi Junction, including the car park, on June 12th and June 13th. So we've had a couple of the cases that have clearly been in Bondi Junction at the time and around the time that the infectious cases were, but we haven't actually been able to capture that CCT moment where they've intersected. And so that means that the acquisitions probably occurred as people are moving about the Westfields Bondi Junction. That does give us cause for concern, because it means that we may not have identified people if people are just looking at particular venues, and therefore we want those high rates of testing. We have called out before, yesterday, for people in a defined period of time, but for simplicity in the message, if anyone has been there on Westfields at Bondi Junction, including the car park on June 12th and 13th, please get a test. If you've been to any of those venues or you have any symptoms, you need to isolate, but that people who do not have symptoms and have not been at a specific exposure venue listed don't need to isolate, but we're asking you to just basically stay at home, only go out where you need to essentially. And the reason we're giving that different message is because we don't want to put any barriers to people attending for testing. We'd much rather have those high testing rates of that large number of people to inform our response. We also have had a detection in our sewerage in the Brooklyn area, and as usual, we are calling out for that community to come forward for testing. At this stage, we have not been able to identify any positive cases and in that catchment. We don't have full visibility because people obviously move around, but we have not had anyone resident in that area that's been recently discharged from our hotel quarantine. So the Brooklyn catchment serves about 1,000 people and covers the suburbs of Dangar Island, Cowan, Brooklyn, Mooney Mooney and Cheerio Point. There is also a detection in Camilla North and Camilla South pumping stations in Sydney's western suburbs, and that serves Harris Park, Granville, South Granville, Mays Hill, Maryland's West, North Parramatta, South Wentworthville, Westmead, Guildford West, Sydney Olympic Park, Newington, Holroyd, Clyde, Auburn, Old Guildford, Silverwater and Rose Hill and Rydalmere. We do know that we have had people discharged from quarantine, but for the abundance of caution, we do communicate this and ask for people to be vigilant for signs and symptoms. So my key message is this is a time that we want to see those testing numbers much higher than they currently are. We want you to be stressing our labs to the ultimate end of their testing capacity. And I'd really like to see those numbers today exceed 30 to 40,000 tests. The quicker we can diagnose cases, the quicker we can get ahead of the transmission of this virus. It's been pleasing earlier in the week where we weren't seeing transmission into family contacts and we were getting to them before they had that opportunity to transmit. But we have seen that a couple of these cases are, whilst they haven't transmitted to their family, they've transmitted to their more extended family contacts or in other settings. And so again, this does elevate our level of risk, and the quicker we can get on top of this, the less restrictive we can be. So if everyone can please wear those masks, if everyone can please with the most minimal of symptoms get tested, if everyone can follow the health advice, and we all know the sorts of activities that are associated with greater risk of transmission, if we can all just be particularly careful over the coming days to week, that will really assist us in managing this current situation.
Premier, the federal government gave Victoria extra vaccine doses when they were facing their own outbreak. Are we going to get those? Oh, I always have been calling on getting extra vaccines, and certainly the Prime Minister's called National Cabinet meeting tomorrow, so I'll be raising a number of issues there. But I'm really keen, and I have been from the outset, the vaccine is our road to freedom, is our road to having a COVID normal life. But can I say in the interim how important it is? We're nowhere near having vaccinated the majority of our population yet, so all of us have to do the right thing in the next few days. We'll reassess to see what happens beyond Wednesday or Thursday morning. But until that time, can we ask everybody to please wear those masks in those settings we've asked you to do so?
While we're on vaccines, are you concerned the message about AstraZeneca has been bungled and that people now are going to preserve that vaccine as well?
Well, look, New South Wales government's always followed the health advice. We don't have control. It's not our control or responsibility to provide the supply of the vaccine or provide that advice which is provided by the federal regulators. But can I say this, and Dr. Chant and I had a quick conversation about it this morning, that if you've had your first shot of AstraZeneca, please have your second shot of AstraZeneca because that is really important. But obviously moving forward, there's no doubt that there's been disruption in the vaccine rollout, and New South Wales government is ready and willing to support getting the doses out as soon as we can, but that's dependent on us getting the supply of vaccines to give the public, and that's certainly conversations we'll be having at National Cabinet tomorrow.
Sure, that
Oh, look, there's no doubt it doesn't help. I mean, I'm 50, I had the AstraZeneca, but I know for a whole range of people it excludes them from having access to the vaccine in as timely way that we anticipated. There's no doubt about that. But the New South Wales government can't control that, unfortunately. We depend on the Commonwealth for the vaccine supply and also the advice they provide around those vaccines. But we're just urging, based on the health advice, if you've had your first shot of AstraZeneca, please go and have your second shot. And if you have any issues, please speak to your GP about that. But obviously, the more vaccines we get, the more we'll administer. But that's out of our control. Yeah, I think that the challenge is for us to have the doses. If we have more doses of Pfizer, we can get them out through our New South Wales State Government mass vaccination hubs. We can get them out. We've got 100 sites around New South Wales. We've got a mass vaccination site in Homebush, obviously. We've got hospitals administering the vaccine, and we're looking forward to opening up other sites in the Hunter and elsewhere. So for us, the issue is the supply. If you get us the doses between the GP network and also the New South Wales government, we'll get those jabs in the arms. But the challenge for us is just getting the supply, getting those doses themselves.
The restrictions, firstly, I presume they apply to workplaces across the board, indoors?
Well, whatever rules apply, I'll get Dr. Chant to clarify that, but essentially it's all workplaces have a COVID safe plan, but we'll get Dr. Chant to clarify that point. But in essence, the mask wearing in those 7 local government areas applies to any indoor venue, excluding when you're eating and drinking, obviously. So if you're going shopping, if you're going to the cinemas, if you're sitting down at a conference, any place where you can't guarantee social distancing or in proximity with other people. But I'll get Dr. Chant to cover the issue of workplaces.
Just on that point,
Yeah.
my main question is this, that you very surgically applied it to the 7 council areas. It's complicated, isn't it? I mean, did you consider just going across the
We
board?
did. No, we did. And that's the issue. The issue always is you have to balance up the risk with how heavy-handed you are with the public. And the strongest message that I want to send our community is we've worked on the basis of trust. We've worked on the basis that we won't impose any burdens on communities unless we absolutely have to. So we did toss up going the whole hog of Sydney, and we might need to. But at this stage, given the number of cases and the risk, we feel what we're doing is appropriate. It does mean people have to pay a bit more attention and listen and follow the New South Wales Health website. But we're confident the public will do that. And we also know that if you ask people to do something when they don't feel they need to, that level of complacency then can apply further down the track. And we don't want that. We want people to know in New South Wales, we won't ask you to do something unless we absolutely think it's necessary. And I hope that message gets across. That means we won't burden you unless we have to. But when we do ask you to do something, please do it, because your safety and that of the broader community applies. But I will ask Dr. Chant to comment on workplaces.
And can I first start off to say that we're really encouraging, and we have been for a number of days, to use masks whenever you're in indoor environments. So we would like to see that, and can I applaud when I've did attend a shopping centre, there were a number of people that were following that advice. We would like to see that lift, and that's why we've, the advice we've provided to make it mandatory. But we would like to see it lift across Sydney more broadly. And that's consistent with the advice we've been giving for a number of days. But we are going to mandate it, and that'll allow us to focus our compliance activities and our, working with the community in those settings. And also, I'd like to acknowledge our work with Transport New South Wales, who's also been distributing masks, and we've been focusing on the particular areas we've seen at greater risk. In terms of workplaces are usually not included, except obviously front-facing workplaces where they're in retail settings where you are in contact with the public. That will be clarified. We'll end up issue a fact sheet after this, but basically it's a very similar order and very similar requirements to what we had last time. Our mask order is generally well understood with the community, and we're happy to work with the community if there's any areas of confusion.
The restriction on the baby shop in Shell Harbour. Why has that move been taken? Do we have any instance here?
I'm not going to comment on individual cases. We name the venues where individual cases have attended, make that very obvious to the community, and that's probably what's relevant for the public health risk, that those venues are where infectious people have attended, and therefore people who have looked at those, were in those premises, are at risk. So schools, we have not required to wear masks. We have a range of other COVID-safe practices in place in schools. But if any parents would like to have their child wear a mask, it's been the usual practice that's not been opposed and supported. You know, we support COVID-safe practices, but schools have worked incredibly hard to have a range of COVID-safe practices to keep students safe. They particularly, I think what's important to understand, we need a hierarchy of controls. And schools are very good at making sure that any symptomatic children do not attend and are excluded, and also communicate very effectively about also making sure that people are aware of the venues of concerns, which are our highest risk. So gyms, obviously, in terms of gyms, we know that gyms are high-risk environments. When you're puffing and panting, you are generating lots of droplets. So we do ask for caution, but we also acknowledge the practicality. You know, when you're swimming and doing activities, sometimes it's impossible to wear a mask. So again, it won't be covered necessarily in the order specifically, but we encourage people to take those. But the first step, I'd say, is before you go to any gym, please ensure that you've looked at the website, and we haven't provided contrary advice. I wouldn't be asking anyone who'd been at Bondi Junction on that 12th and the 13th to go to a gym. We'd see that at a high-risk setting, and we're asking people to get tested and not attend those high-risk venues at this time. So again, it's around common sense. I think the community, we've had these conversations many times with the community about those risky activities, and we're just asking everyone to really moderate at this time, ensure that social distancing, ensure that there's, you know, the gyms are making sure classes are not crowded, and there's good spacing. So again, business has generally responded well and taken the consideration their patrons' well-being.
Just on the QR codes, how well are they working? How many people are they picking up in those massive shopping centres like Bondi? Are people actually checking into those places?
Can I just say the QR codes have been amazing. And moving up to this point, we had noticed some decline in compliance, and probably for the few weeks or even 3 or 4 weeks before, we had done a lot of compliance activity across government, and also a lot of reinforcing those messages. Clearly, compliance is not absolute, and particularly things like retail, and that's probably why it gives us greater concerns. But we did have QR check-in data from a number of these retail venues, and I thank everyone for taking that time. The Service New South Wales app is just such a very quick method, so please just take that time. We've also done work to make sure that the QR codes go at the front of the premises. We had noticed that they were sort of drifting towards the back, and we'd asked that there be a bit of a push to get them at the front, get them in multiple points, so there was no barriers to people signing in. In the COVID safety plans, we're clearly updated all the COVID safety requirements and requiring them to be visible in front. If you'd like to tell us that retail premise, we'd be happy to follow them up. And I think the message is everyone has a role to play. We're also asking for businesses to, you know, step up and double check where they've got their QR codes entry, make them available. That's going to be a critical part of our response, and it's incredibly helpful. So at the moment, we're trying to flush out any unrecognised cases through that sort of intermittent, very, very minimal contact, and one that you wouldn't have actually recognised. And so we think it's a simpler message just saying if you've been there on the 12th and the 13th, please get a test. It's a simpler message, and we're just asking the community. And people that have attended Bondi Junction will often be drawn from the local community anyway, so it actually provides us that double assurance. In terms of the surveillance, we follow the usual process where we have our close contact tracing team contact people regularly in isolation who have been in that isolating for those 14 days. And we do address any non-compliance issues. I understand that everyone is getting fatigued. It's been a very long haul with COVID. But again, I think you raise a really valid point that we need to have people compliant with that 14-day isolation. And that doesn't mean going out or thinking you can slip down to the shops or anything. We really do want a high level of compliance. We do monitor compliance and we do escalate and work in partnership with police, but in general, the vast majority of the community actually takes the public health advice and follows it accurately. And I again extend my appreciation to the community for doing so. So in terms of the Delta variant, we sequence them, the sequencing lab is sequencing strains as they get into the lab. It obviously takes a few days for those sequences to be undertaken. At the moment, everything appears to be linked and plausibly linked and explained. But again, we'll update you because obviously it's critical in any investigation. You keep an open mind. As you know, there's been, in the Victorian situation, they were actually dealing with two separate outbreaks, one with the Kappa strain and one with the Delta strain. We, in Avalon, actually had two different outbreaks concurrently. So we never, it's always very important we keep a very open mind in investigations, and we'll update you because obviously that would have additional significance if they weren't all linked. So that, I think we'd confirmed or have said previously that limousine driver, I'll just need to check because obviously that's health information, and we'll see if we can make a statement, but I think that may have been previously commented upon. But obviously we urge people to be vaccinated, but a key message also is just because you're vaccinated, you can still get infected and be infectious. Thank you.